Hello and welcome. I'm Don Mecoy. I'm the managing editor at the Oklahoman and Oklahoman.com. I'm joined today by Carmen Foreman, who's our political reporter who also specializes in COVID coverage. And we've had a lot of both lately, but we're here to talk about COVID today. The numbers have not been good in Oklahoma. Over 2,000 cases were reported, new cases were reported today, which is the highest number we've ever seen. There's over 1,000 people currently hospitalized with COVID confirmed cases or symptoms, which is also the highest number we've seen. And the average of daily deaths is as high as we've ever seen since this whole pandemic started. And one thing, Carmen, that you've been looking at that we're focusing on is just the impact on hospitals. And they've unveiled this new surge plan for COVID. And I guess Oklahoma City has now entered a new level of bad, I suppose. Tell us a little bit about that.
Yeah, so there are varying degrees of bad, as you would put it. And today, the Oklahoma City Metro is one of 8 hospital regions, according to the state's hospital surge plan. And we are the first region to enter tier 3 of hospitalizations. So, I guess the best way to explain it is the surge plan is a 4-tiered plan. If we get to tier 4, we are doing it wrong and we are in a very, very bad place. So tier 3, we're now the first of 8 regions to enter tier 3. Some are still in tier 1, some are in tier 2, and we were in tier 2 and now we're tier 3. And that essentially means that our hospitalization numbers are growing. And so what it takes to move from one tier to another tier is, basically they look at the percentage of COVID patients versus other patients in hospitals in a region. And if a region hits a certain percentage for 3 or more days, then you're classified in a certain tier based on that.
Well, and it is rather complex to understand these percentages and so forth. But what essentially is that? What takes place now that Oklahoma City has entered in this new tier? What happens?
Yeah, so the surge plan basically spells out every tier and the options or things that could happen at every tier. And so for for this one, there is an option for the governor to reduce elective surgeries, and he could issue an executive order. It does not sound like he's going to do that. There's also another option where the governor would request a catastrophic health emergency and the additional powers that go with that. And that's sort of a whole thing because the legislature, which is not currently in session, he would have to call them back into a special session, which is sort of difficult because they're renovating the House chamber right now. So you couldn't even put them anywhere up there. But then they would have to approve the governor's request for health emergency powers. And then those powers would essentially give him 30 more days, to deal with the pandemic. And it's kind of complicated and very nitty gritty, but essentially a health emergency declaration would let him, undo state statutes or ignore state laws to improve the COVID pandemic response. It does not sound like the governor's going to do that either. And then, the various tiers, they offer sort of guidance for the hospitals, what they can do to, limit elective surgeries or, steps that they can take to limit the number of patients they're seeing or to better spread out the patients they're seeing. So I think that answers your question.
Yeah, it does. But and none of these things that you've mentioned that policymakers and politicians, elected officials can do, none of that prevents these hospitals from taking the actions that they need to take to make sure that they've got the staffing, they've got the beds, they've got the care, the level of care that they need. They're able to do all these things independently of this plan, right?
Correct. And it's, when you talk to state officials, there's sort of a fine line because they are really hesitant to dictate to the hospitals how they run their businesses. And obviously, COVID could get to such a bad point that, somebody has to step in and somebody has to tell the hospitals you can't have elective surgeries anymore. But it feels like we're not quite at that point. And one thing I feel like mentioning is the tiers. Tier 3 is very broad. So Tier 2 was essentially if you had more than 15% of your COVID patients in a region at hospitals in a region, between 15 and 19%. If you had that many patients that were COVID patients, you were in Tier 2. But then Tier 3 is a little different because it's basically just above 20% to 39% of your patients being COVID patients, then you stay in Tier 3. So we hit 20.1% on Monday. And so, we could be anywhere from 20.1% to 38.9% and still be in that Tier 3 area.
But I guess if you've got an elective surgery planned, or if you have some kind of procedure that might require an ICU stay even for a short time, I mean, I guess it could affect some people like that just because the hospitals might decide we need to sort of step back from some of these things so we can care with this increased number of COVID patients.
Yes, definitely. And health officials around the metro have basically said, that's where we're at, that the hospitals will have to make decisions on, which patients they see. And, if you, let's say you hurt your foot and then the guy next to you, you go to the hospital, the guy next to you has COVID and is very serious condition. I mean, obviously hospitals are saying they can still see all patients right now, but we may get to a point where, if you hurt your foot and you don't need surgery right away, they might ask you to maybe put that off for a few weeks or a few months. But so far, I mean, there's no widespread just halting all elective surgeries like we saw in the spring.
Right. Yeah. Well, and it's interesting as we go through this pandemic, and we heard this at the beginning, but now we've really seen it in action, that when the case numbers go up, later you will see an increase in hospitalizations. And then after that, you will see an increase in the number of deaths. And we're kind of seeing all of those things come into play right now because all of our numbers are as high as they've been at any time during this pandemic.
Yeah. And I mean, health officials are certainly concerned because, we're really at sort of the start of flu season. And, they have concerns that the COVID hospitalizations mixed with the, every year some people get the flu and they get so sick that they have to be hospitalized. So all those together, plus, regular hospitalizations could really exacerbate what we're seeing at the hospitals right now and really stretch them thin. Not to mention, I think about how, we have holidays coming up. Some people will likely be traveling, seeing their families, and, health officials are warning that all of these things can spread COVID more, unfortunately.
Yeah. Well, and you also have, it may be a minor concern, but you also have people who work at hospitals who like to take some time off around the holidays. These people can't work 7 days a week, 24 hours a day. So there's staffing considerations as well tied to all this. It's not just beds. It's can we staff the beds? So it's an interesting story. It's a developing story. Carmen will be continuing to work on this. We've got other reporters, obviously, covering COVID every day, and we will have coverage of this story in tomorrow's edition of The Oklahoman. And you can read it right now at oklahoman.com. So check in with us, and thanks for joining us today.